Okay, all right. So the one thing with this is before I lie him down and look at his heart, one thing you're going to do first, I had to palpate his carotid, right? So am I going to do both hands at one time?
No.
No, because what could happen? What? he could pass out. Funny. Okay, so he could pass out, right? So you always want to palpate on one side, okay? And obviously, I would have inspected for any jugular vein distension. I'm not going to measure it, but you can absolutely see it. And on one of the PowerPoint slides, you could see the jugular vein distension. I mean, it's pretty prominent, right? Okay, so Ray, I'm going to go ahead and palpate now your carotid, okay? Okay, so he has a good, strong pulse, and the pulses should be what? I mean, how are you going to grade it? 0 is nothing, right? You don't feel anything. So, yeah, 1 is 3. So what is normal? 2 plus, okay? So 2 plus, and I would have felt it on the other side too, okay? So carotid pulse is 2 plus. And then what I'm going to do is I'm going to check for what?
Bruise.
Bruise, okay? The swishing sound. Which side am I going to use?
The bed.
Use the bell, okay? And remember how to, remember how to hold it? It's like this, right? It's not like this, it's like this. So I'm going to go ahead and have you exhale and hold it. Okay. So I don't feel any, I don't hear any bruise. Now I know that your book has the 3 different level of positioning. Just do the mid-cervical one. I've talked to cardiologists and they don't do the 3 different things that you notice in Jarvis. You guys know what I'm talking about, right?
Mm-hmm.
Jarvis, they had the base of the neck, the middle, and then the bottom. You just do the middle, okay? I mean, yeah, you don't have to do all 3 of them, okay? All right, so I think we're done with the carotid now. So what I'm going to do is I'm going to lay you down. Is that okay? Okay, I'm going to lie you down. Okay, lie down. And I would have adequate lighting here. Okay, I'm going to undress you here. Okay, so what I'm going to do is you need exposure to the chest area. Yeah, you guys can come closer. Those of you over there, what are you doing over there? Okay, so obviously you're going to look at his chest area, right? So I can notice, and you would have taken his vital signs, you know, obviously we will check for apical pulse and all of that. But I'm looking at any pulsations, right? First of all, the color of his skin, it's got pink with white and some moles and stuff, but he's not cyanotic, he's not having any breathing difficulty or anything. So what I'm going to do is I'm going to look for any, when you have people with cardiac problems, I don't know if you've seen it, but you can see their chest like rising. And anyway, I don't see looking at Ray's chest that he has any heaves or lifts, okay? So that means if he did, he would have maybe some enlargement of his ventricle or something, the left ventricle, which he doesn't, okay? All right, so I'm looking for lifts or heaves, any pulsations, okay? So now I think I can palpate you, okay? So what I'm going to do is I'm going to palpate for your apical pulse, okay? So what usually happens is the apical pulse is going to be, well, I would have measured him for his heart sounds, but remember the sternal notch, and you go down, and then I feel that ridge, so that is equal to the second intercostals, okay? So, let's see, hold on, second, third, fourth, fifth. Okay, so with the mid-clavicular, and I would turn you over a little bit. So if you want to turn to your left a little bit. Okay, sorry. Okay, and I'm just going to have you, I'm going to just have you exhale and hold it. Okay, so I'm feeling for his apical impulse, and I feel it. It's a short little tap, right? It shouldn't be larger than what? What did your book say? It was like 1 by 2. Okay,
Yeah.
so it should be a short tap, because if it's bigger, then maybe you have a enlarged heart, right? Okay, so the apical impulse, just a short tap, and I felt it at the 5th left mid-clavicular line. Okay, and it's intact. So we check for apical impulse. I'm blanking out here. Okay, so I'm gonna go to, oh, thrills, I didn't do that. So I'm going to check your chest anyway. Do you feel anything when I palpate anything? Okay, I'm gonna come over here, and I don't feel a purring cat, okay? So there's no purring cat or a thrill sound, okay? So he probably doesn't have any problems with murmurs or anything like that, okay? So now what I'm gonna do, Ray, is I'm gonna check for, I think I can go to heart sounds now, right? So what I'm going to do, again, do the sternal notch, right? You come down, you feel that ridge. So that's equal to right by the sternal. So second intercostal space, right? On the right side, by the right sternal border is the, come on guys, aortic, right? Okay. And then aortic, right? And then when you go across, it's going to be the pulmonic, right? And then you're going to go down and you're going to, we're not doing the herbs point, okay? So you can do the tricuspid, okay, at the fourth, right? And then you're going to walk down to the fifth, and the mid-clavicular line should be where your mitral, okay? All right, so I'm going to go ahead and listen to those sounds, okay? Okay. Okay, and he has, and I'm going to go back up. Okay, so when I heard Mr. Ray with his heart sounds, he had S1 and S2, lub-dub, okay, and it was regular, lub-dub, lub-dub, lub-dub. There was no, so S1, S2 is regular. There was no S3, no S4. I couldn't hear any murmurs. And then you can also have him sit up and do this. You can have him lean over. You can have him listen when he's like in the left lateral position, okay, for that. So I didn't hear any abnormal sounds, any extra heart sounds, whatever, okay. So then I think there's a peripheral vascular part of that paper, right? So what I'm going to do is, we've already discussed this a little bit, but you would check, you know, you would check his skin, obviously. You would make sure that it was warm and dry and stuff. You would make sure there's no swelling. You would check for his skin turgor, right? If his skin turgor is, he's not dehydrated. I would look at his fingernails also, making sure they're not cyanotic. You still have that bruise now. So I would look at his nail angle and such, and it's, you know, 160, and it's not greater than 180. His nails are pink. It's not cyanotic, that kind of stuff, okay? So then I think we're checking pulses, right? So we're only checking a few. Oh, what happened to your arm?
I have this weird, I had this rash earlier.
Okay.
Just
so I'm
started out of
checking
nowhere.
his brachial, which is palpable, and it's 2+. Okay. So I would go over there and check it, but I'm just going to check it on one side. So I'm checking his pulse. So that's the brachial. Then I'm going to check his radial pulse, right? And you'll be measuring it. You'll be checking. Okay. So it's regular. It's even, it's not bounding or anything like that. And you would measure how many, you know, what the pulse rate would be, but let's just say it's 80 per minute regular. Okay, now you got to take off your shoes. I forgot to tell you. Sorry.
I hope your feet don't
So,
stink.
They're
when you're doing-
terrible, like death.
So if you're doing the or let's say you pick the cardiac one, time constraints, but I'm going to go ahead. Okay, oh, good pulse. All right, so, yeah, so the dorsalis, right? And then you want to do the what? The tibial?
Posterior tibial.
Oh, you have a good pulse. Yeah. So it'll be 2+. Okay. So some people don't have a pulse, you know. Sometimes they don't have a pulse that you can palpate, which is not very good, but maybe they have poor circulation. Okay. So I think that was it. Was that basic? Did I miss? I feel like I missed something.
Popliteal and
No, we're not doing that. No.
Sorry.
So, okay, obviously I didn't check all the